I'm going to talk generally about prelim year, kind of what's the point, what you can you gain out of it, and specifically surgical internship prelim year. I think a lot of the things I'll talk about, you can find this general advice online, but what I hope I can impress upon you is like some of the specifics after I went through it that I kind of took away, especially with the perspective of someone going through an integrated interventional residency program. So that's really what I hope will add some value in my presentation here. And just for context, I'm a second year resident of PGY2 at Kaiser Permanente. It's a vascular interventional program. So okay, what's the goal of prelim year anyways? So when you read about it, you hear a lot of different perspectives online. Like some people are really defeatist about it sometimes. They think that it's just a way for hospitals to take advantage of residents who don't really have a choice and that they are going to, be stuck and wasting kind of a year of their life. I think that's definitely not the case, especially as an integrated resident, because this is a really nice opportunity for us to really build on top of the foundations you are going to want to have established as a third and fourth year on your rotations anyways, like Satya and Ashley just talked about. So this now you're a resident, you have more responsibilities. And if you don't do things, patient care just doesn't happen. So it's a lot more on your plate. You have less people to be able to defer to, although there is a strict hierarchy in medicine, which helps make sure, especially initially, that things are getting done. So you need to learn what every medical resident is going to learn all across the US, which is how does a hospital function? It's a very big, complicated bureaucratic process to actually get things done in a hospital system, and there's always more steps and clicks to doing anything than you'd expect. You got to learn how to see these patients, admit them, place orders, and ultimately disposition them into the next phase of care, whichever that may be. And it's a really good time for you to start seeing these different phases of care as well. What's really the difference between a regular floor versus an ICU? Who needs ICU level care? What are the different types of that? And how do they kind of get triaged when you first see them, maybe in the ED, for instance, when you're seeing consults and then eventually staffing them out with your seniors and your attendings. So a lot of that stuff, assumes that you're already pretty good at doing the core concepts of what you need to be able to do as a medical student, which is perform an interview. You're no longer giving your whole spiel during your presentation to your seniors. You're now just focusing in on the highest yield things with the assumption that you are going to have done the baseline work that's necessary for each patient. So it's really important that you've already set some foundations and that you're building on top of this. For your first few months of residency, you're really just going to be focusing on different checklists and really figuring out how to do the uh, carry out the plans made by your team. And then as you get more comfortable, you can start to notice more of the science and the art that comes with dealing with medicines, studying these guidelines, and seeing the gray zones between it so that you can carry out these functions. But initially it's primarily just going to be your seniors telling you what to do. That's just a part of being an intern. You just got to learn how to carry out actions before you start taking more and more ownership over the care of your patients, and as well as their plan. So, let's see. What I kind of did when I entered prelim year was to kind of think about what I would want to be able to do as an attending, and then kind of emulate how I can maximize those things and lay a really nice foundation so that when I am eventually attending, it won't be such a difficult process to transition into the things I need to do. So, with our current training paradigm, we already get a lot of like image interpretation and training and technical ability trainings. So I think that will come naturally. But what I thought would probably make me more, uncomfortable, kind of like our private practice panel mentioned just before, is that if I see a patient and I don't know how to clinically work them up or handle their complex conditions, our baseline population is going to be full of comorbid conditions. Dr. V always mentions heart, lung, liver, kidney, brain. You want to get used to seeing how we think about these patients with their comorbidities, treat them, what medications they're on, how you adjust certain medications you give, what you do, when you give fluids, when you don't, all that kind of stuff with their comorbid conditions. And then you want to ultimately be able to treat a more deranged physiology because we're often consulted when they're already in some form of shock. I wanted to understand other services. How do you get referral patterns? Because ultimately, as a VIR attending, I want to be able to own a disease well enough to just get referrals from my primary care physicians and then sell that to patients and give them the appropriate care. And ultimately, the what I think is the end goal is that I'm doing all of these, I'm juggling all of these at the same time, clinic, procedures, and floor patients. They're all different um, aspects of care, but it's all facets that you wanted to be, sort of easy by the time I'm attending. So that's kind of turning into some of the nuts and bolts of why I think surgical internship is very beneficial. So I'm dealing with a very similar patient population that I'm going to be dealing with as a VR attending, where general surgeons deal with a lot of cancer. They're cutting out all types of cancer, figuring out how to work up an oncology patient, figuring out who's really sick, who's not sick, for if it's like an acute abdomen or an appendectomy or something like that, and then managing their post-op care. They see all facets pre-op, in the clinic as an undifferentiated patient, deal with it in the OR, and then round on them after the um, procedure is done so that they can ultimately, deal with any post-surgical complications or consult services for that. So I thought that was a really holistic view of things that I would want to be able to do. And they have gained a lot of institutional knowledge and built a lot of habits over time to really allow them to do that. And I think emulating those habits is going to be really key for going into surgery. So I think that surgical decision making is also key. Surgeons are get really busy because they're juggling these three different things: clinic, OR, and inflate inpatients. So they often find efficient ways to get things done, like how to efficiently round, how to get your notes in, how to get your orders in, and how to move on to the next thing. So I really think that you pick up some really good habits on how to be efficient. And, you were always studying anatomy in great detail. And I think that just goes hand in hand with what we're going to need to be able to handle. They have an in-service exam for called AppSite. I think that's a bit was helpful for me, not just for getting a handle on certain rotations, but also just learning those basics of critical care that I really appreciated getting exposure to at that time. So one caveat to kind of understand is that there's actually a lot of difference in how surgical programs will structure their year and their prelims years, and I didn't really appreciate that as a applicant. Once I got here, I'm very happy with how things turned out, but there's subtle differences, I guess, that I wasn't aware of since I was mostly focused on how to match into a categorical interventional program. So some of those differences were really apparent when I was talking with, I think, with Justine yesterday during the social hours. So you know, she also did a surgical program, but it was structured very different from mine in that she had a busier floor patient load so that she was doing more of the floor work, which meant that she saw a lot of, more in floor patients, which she still ultimately got a lot of benefit from. For me, I think at Kaiser's program, we have fewer floor patients, but I find that some of the benefits that I get from that is that I get to be very hands-on, and then I also get to see more consults and try to think about more undifferentiated patients because we have smaller teams. It was just me, a senior resident, and then my attending. If the senior's out or in a different case for whatever reason, it was often just me and my attending. So this picture here is me using an argon laser, which is a super cool device that to stop some of the bleeding after partial hepatectomy. And I was just me and my attending doing the whole case. I'm helping with the X-lab, digging down, helping getting the technical skills to tie off any vessels as we go in. If we encounter anything, finding bleeders, I'm very hands-on, and I was getting to do things I would never think of like a prelim surgery intern would usually even do, but it was awesome. And for me, as someone that appreciates, getting hands-on and learning some of the nitty-gritty technical facets of surgery, I thought that was awesome. And one of the very strong things you learn how to develop is a pertinent physical exam. Like you need to learn who's sick and not sick when you are doing rounds, just because my floor patients weren't always as high as maybe like a big trauma hospital. It doesn't mean I didn't have like sometimes 20 plus patients on the floor. I got around on them all. So I got to figure out how to do a really nitty gritty like interview and reliable physical exam. Like oftentimes their abdomen is telling me more than the patient will, especially if they're incapacitated or whatnot, about what I want to do for my plan. And developing that sensitivity and specificity for acuity of acute abdomens is something you just are going to develop because you see so many acute abdomens in surgery. So how do you succeed as an intern? I don't think anything here that I have is particularly like new when you look online. You checklists, make them very frequently. You at one thing that was really impressed upon me was the importance of attention to detail. Those things that Satya and Ashley mentioned about doing the small things right. It really carries over as an intern. You will be trusted with all the endless documentation, and no one else is going to take more time than you are to make sure it's done right because they're busy worrying about other things. And so they will eventually notice if you're not doing those things appropriately. And if they'll correct you, but at some point they may even just give up and just not be able to trust the work you do, which is not what you want. So, the small details matter. You don't want to be right documenting a palpable pulse on a foot that was just amputated like a week ago. Which is, things that happen because you're busy and you're moving forward. Just try to pay attention to the small details because that's what you can control, especially initially as an intern. Find strong seniors and emulate them. That was like very key for me. I found some very impressive seniors that were quite intimidating, but I just there at the same time we had small teams. We worked very closely. I could befriend them, learn what they do to become so strong, and really how do they get things done. I really respected them for that. And then I asked them just like, how do you study? Because, ultimately, I just wanted to emulate everything they did. And I saw myself as if I acted as if I was a categorical resident, which was key for getting a lot out of each rotation. Attitude, you always want to be humble. As an intern, you know nothing, you'll definitely be humble. But once you reach that February intern status around this time of year, you're going to reach that peak Dunning-Kruger curve initially, and you're just going to feel a bit more confident and you may make some more mistakes. That's when attention to detail is very important because then you'll start to realize how much you really don't know and how much, each of these small things ultimately matters. But first and foremost, always, always, always do right by the patient. If you are scared about somebody, you make sure you put it up the chain and that you will have at least a senior come check in on them because ultimately it's much better to be a little too sensitive than too blasé about changes in patient care status. Uh, there's very pertinent times where I remember attending saying like, if you're too nonchalant about changes in patient care, they can't trust you. And that's the last thing you want. You don't want to be someone that the team cannot trust because your role is very invaluable, even though it can oftentimes feel like scut work. I'm just going to list a couple high yield rotations here that I personally enjoyed during my intern year. Intern years will vary. Surgical prelim years will vary in what you can do, but these made a lot of sense to me, like vascular, surg-onc, those go hand in hand as far as patients that we share and care for. Night float was a great time for me to become more independent because there's less of a team and you're doing more decisions independently. So it's a good time to grow your skills and kind of, figure out, really learn who's sick, not sick. And then some of the other things, ICU, of course, and peds, it's been helpful because it's a totally different patient population. You're kind of out of the water again, but you deal with it a lot in diagnostic radiology, actually, and it's been pretty high yield to, understand what does intussusception look like and how do you deal with hyperperfusive pyloric stenosis, how it presents, and the management. Surgery can be busy. It's very rotation dependent. There are times that I was working like pretty long hours, but not all the time. Some hours are much more respectable. This is a picture of me when after one of those busier rotations, I wanted to hang out with some friends or, my wife. I went out to a rooftop bar, found a couch, and before I knew it, I passed out. So, it can be really busy and you're going to try to find some balance. And I think it's important you do, find ways to stay grounded. For me, it's like me and the pups. and my wife, we just go on picnics every now and then, every few days. So take some walks. It's just a valuable way that you're going to be busy, but you don't want to lose yourself. It's still an important year of your life. You're growing, you're changing, you're developing, and it's not a bad time just because you're busy. No matter what, you're going to make fantastic memories. I have amazing memories of times like going to birthdays at breweries, restaurants, hangouts late at night, doing face masks while answering pages on overnight call, going to picnics when with all my residents. Overall, I have zero regrets, and I just gained so much from it. And just because it can sound scary because you're busy, sometimes realize like you're going to be busy. Period. As an intern, there's going to be periods where you're going to be working around that 80-hour like mark. But ultimately, I think that it really helped me gain a lot of knowledge and a foundation to build upon.